Но
того, как не извлекли.
Но ротации нет.
rotation нет. Вот that's one. No rotation. So we'll pull fast this one.
Hold fast and
And then if it comes near the capitulum, then we'll open or we'll pull it to the olive.
yeah. Then you have to also centralize the wrist also and get the lengthening of ulna also.
No, when we do like this, now when we are pulling, do you go for any kind of osteotomy here?
Yes.
For lengthening, for correction of the
Yeah, that's what
deformity?
I'm telling you. For correction we have to do because we have to get the wrist here also.
This is your telling.
Or
After that, yes, second time, yes, I see.
Second time, he will go for second time.
second time
He
only.
is pulling down. This one, it will come only the radius. Then second time,
Second
you can
time
do
we
the
correct
osteotomy
the
here, and you can go for the lengthening of the ulna.
Push one stage. We can pull and get the lengthening of the ulna also. Why you want to waste time?
We decided previously. We decided that we will go for. We will not touch the. We will touch the ulna here. We will touch the ulna here, and distally we will go for the one.
Here and correct the deformity, no problem.
Please calculate how many rings.
4 rings.
Да, твое он не показал.
First ring here. Listen everyone. First ring here. Next, then you remove this one. Then you this part of the radius you fix there in the capitulum. Okay. After this you are
Твое
going to
кольцо,
remove.
второе кольцо на
how much you
луче
are
не
going
показал,
to
на локте не
remove?
показал.
На каком уровне?
Tuberosities of the radius.
Tuberosities of the radius. Here this is rotated a little bit. After the
Millimeter and a half distal by the neck of the radius.
neck of the radius here. Then you put it. You put it here. One ring here.
Yes.
Да.
And second ring
The second ring
here.
here. One wire in radius and one wire in ulna.
Allah.
The third ring only on radius
Radius,
here
yeah.
and the fourth on the wrist.
Yes.
After the second stage, we remove the wire from the radius, have the hinge here, and take the second wire in this
Position.
ring.
Ring.
Yeah. And now we have a Prof diaphysis of the radius. Make me osteotomy right here of ulna and the wire here, and track it by this ring.
Now in one stage you want to do this or second stage?
Second stage. Without
Okay.
remove ring.
Oh,
Он сейчас
I
он
understand.
добавил.
I understand.
Вернее, ты добавил. Нет, а этого кольца не было, про которое. Второе кольцо на луче, его не было. Сейчас оно появилось. Ну хорошо.
No, хорошо. That's it. First ring, remove this near the radial tuberosity. Then when your radius is in the capitula, here you second ring, third ring here, do the deformity here, osteotomy, and third ring here. Okay? First ring, second ring, third ring, and fourth ring. Ishwaraji, пять получается как-то половина. Is it Ninada? Ninada?
No, it's the second stage.
Second stage. Okay.
А еще после резекции чуть-чуть не изводиться будет или нет?
После резекции обычно возможно вообще просто произвольное управление руками. То есть в операционной уже будет вот это вот эффект.
Вот если оно не пойдет, тогда во втором кольце на предплечье,
Во втором это втором.
ну вот которое это
В
лучше.
максимальном кольце на предплечье.
Нет, второе кольцо. Ну промежуточное.
Да.
Если потребуется низведение, то как? Луча.
Почему мы должны не заводить луч за счет среднего опора?
Ты ее наложил.
You want to add something, sir?
И пусть она будет, ты сказал, что через луч проводим.
Через луч проводим спицы, через луч, через оптовок, луч, через оба кости предплечья, в максимальном третьем.
So can we have that in English?
Это в проксимальной клетке.
Да, аппроксимально это же.
Промежуточный.
Промежуточная опора, одна спица у нас будет через луч.
Sir, English, please, sir. Can you have it in English?
Just a moment.
В третьей опоре одна спица через локоть. И опора там.
What is it again?
He is strong in his
I think
Really?
you should see one benefit I'll tell you. The shape of the radius, upper part is made like a radius. If we distract, it's a better anatomic thing. The shape is
because
it is shaping like that. It will have a better.
hey, sign call of Michael. See, if you pull this is from up to here, we calculate 5 centimeter.
Yes, sir.
5 centimeter means 50 millimeter. 50 days you should have to distract. Okay? 50 days you should have to distract. When your this distal proximal part of the radius is here, then you can open because there are a lot of scar tissues, fibrous tissues there. Then you can pull it, you fix it with the throw. Yes, sir.
With olive oil, sir.
Yes. And then this is your first stage. First is, no, this is second stage. Because now first you are distracted. Second. This is second. Then again you go for third stage. That is deformity correction and lengthening of it. 3 stage. If you do like that.
Sir, I don't think there is much deformity in the radius because it's
No,
not
no, there
radial
is a Boeing.
There is a Boeing, but it's
See,
not.
the
No,
wrist
no,
is
this is
also
going. See.
There is a
Radius is
Boeing.
not like this.
And you lengthen that, it will go more on the other side when you lengthen it. So
No.
you have to do the osteotomy of the
Look at
ear.
the radius here. Just clinically you see there is a deformity
When you
here.
lengthen the ulna, because it is going like this because there is no support in the ulna.
So you will correct the bone, you correct the bone and then lengthen it.
Flexion is also restricted.
Вот у меня есть больная, я только не привез слайд. Очень такая патология.
Fold.
Значит, мы ей сделали верхняя опора на локте, низведение луча, потом ее фиксация к локтю, и потом остомия локтя для удлинения и исправления этой информации. Все.
Значит, не удаляем это
Не
сейчас?
ударяли, да.
Не удаляли,
Ну,
но
да. Но тут может быть, скажем, когда вы будете не изводить головку, могут появиться боли.
Just now explain, Professor Shvetsov explained, he has absolutely same patient. And
Problem.
first they apply frame on the ulna,
Professor is
Right, sir.
telling,
second frame
here
for
is the
the
slide.
radius,
He has done the cages.
and we will
Instruction
pull it
fast.
И
cap
эта больная
of radius
лечилась
on the
на
place,
Okay.
and then second stage we lens and correct deformity of ulna simultaneously.
Bloodless operation, you go for distraction. Это
So he wants distraction first.
я тоже так делал. У меня книжка есть, там можете посмотреть.
Sorry, as far as functional is very good in the elbow and the wrist. One should be careful about this. Any procedure you are doing, whether you are sacrificing mobility and painless joint, that's very important to be taken in consideration.
Exactly.
And second thing, even if we are doing arthrodiastasis for the radiohumeral joint, only radiohumeral, otherwise ulnohumeral is good. We have to be careful about that. The shape of the radius, head of radius is abnormal.
Shade of the radius.
Shape, yes.
Where? Maximal or
It's
distal?
a head of radius.
The radial
yes.
height.
Yes.
Shape,
Do you think it is normal?
No cartilage here.
no cartilage here.
So anyway, anything you are doing, please think from the function, mobility of wrist and elbow and pain.
So we have to think about the final functional output also. How much hand the functional it is. It should not be stiff.
And the second, we have no
Just the deformity correction is not important.
second ligament.
Just lengthening is not
No
important.
ligaments here.
We have to see whether the hand is functional or not at the end.
And the ligament is also
And so we'll. No, что?
Это у нас
Есть
another
вариант,
Моё-
есть вариант с резекцией.
So what do you think, sir?
last point.
He is telling very end you can go for dissection.
Both of
You
way
will do those
possible.
dissection.
Must ask parents.
Eh?
Mother ready for cut off cup?
We charge it carefully.
She'll always be ready. Because she has a bump, she always be ready.
স্যার আপনি যেটা করে ঠিক করতে পারবেন ওটাই
You are the judge, you are the master.
Это, мнение, что я говорю, что вы говорите, нет, что я говорю, она говорит.
И что она говорит?
Ты говоришь, что я буду говорить, это будет то.
Ну, правильно.
Right, sir.
Значит, what I am telling,
So what is your decision?
What is your
I have
decision?
two decisions. Two decisions. For making this, keeping this, we decided firstly. Now I have taken your opinion. I will go for destruction first stage, gradually. Then when it will come up here, then we'll put the olive. This is corrected, okay? And then second stage,
You go for deformity
correction
correction and
and
lengthening.
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 Тут описана методика, це
But I am at the same time respecting his
Если резекцию не
opinion.
делать, бред.
А?
Если резекцию не делать, то будете удлинять одну локтевую кость. Сделайте резекцию, надо будет удлинять обе кости.
The when he is telling, when you are going for resection, you can go for lengthening of the both.
Boss of.
Yes, that is a good possibility.
Yes.
Yes.
значить потом еще
That
Нет.
that makes the procedure simple.
Deformity correction
Если
of the-
сделаешь, потом обе кости надо удлинять.
Вот это ты так
Если
говоришь.
потом не получится,
Как не
обе
получится? If this cartilage, no cartilage, fibrous tissue here, you must think about that.
Yeah, there's no
Shape of
joint.
the head is not normal. No cartilage. Since she is running 12 years and 2 months, see the problem is here. And he is also telling us it. So now, Vladimir, we очень уважаемый человек. You are very much respected as senior. So what's your opinion?
Вы же сказали, как вы скажете, так и будет.
Это она говорит, я говорю.
И вы скажете. И вы
He's telling what
скажете.
I'll
Чего
tell.
вы склоняетесь?
Okay, we'll go to the OT and we'll see. Now,
Okay.
okay?
Thanks.
I have concerns, sir.
5 minutes. Okay, tell.
If we lengthen the ulna and they make the ulna radio-ulnar joint touching the carpal bone, is it that will change the painful situation for the patient?
Here.
My idea is to keep the
She is not complaining any pain.
not now.
Cosmetic.
Cosmetic.
After lengthening, yeah.
I think no, because we have done. This is not the normal.
Yes,
no,
for
This
sure.
is not the normal.
But if you bring the ulna with abnormal distal end, abnormal end to the carpal
Affect
bones,
the
it
joint.
will
Affect,
cause
definitely.
There-
pain.
Not pain.
Not pain.
Restriction of the movement.
This is one. So let's keep the relation between the radio-ulnar joint as it is here,
Yeah.
and we do the osteotomy more proximal to correct only things and lengthen at the same time. So we keep the relation distally the same situation that we have here, and proximally we resect the radial head.
Dennis. Then we will remove, right? Oh yes. Go. We will disturb the radius. That's why we must fix the radius. No, must fix the ulna.
Only for ulna,
Only for ulna.
because we will track the radius behind the ulna.
See? তোমরা দেখতে পাচ্ছ? I am putting the olive in the ulna. This is ulna? See. Okay.
Frame.
This okay? See, it's okay? Okay? Look at this. দেখা যায়? ডাক্তার তোমরা দেখো আমি 5 in the proximal ulna. In the proximal, it's okay? Okay. No. Thing before introducing the wire, we have pushed a small incision so that I can push the olive up. Okay? Finished? Have you seen that? Making the angle in between the two wires.
Make a maximum pronation,
Pronation.
for purpose for don't fix the radius here, because and you will also have two cuticles, one and the first, and that's why we are sure that we only for ulna.
In the pointed end of the one console wire here we put. Console wire means the wire that was passing from one cortex to another cortex. Cannulated দেখো এখানে আমার বাড়ি ইলিজারভ লেখা আছে না বুঝছো
Dr. Bari, I have a question.
Yes.
So, doctor, if suppose we take ulna, we have put 2 wires, now we'll put it in humerus. How we are going to distract and radius will come from
Yeah.
No, but
This is another way.
So you will be distracting radius versus ulna, right?
Radius passing only one cortex to another cortex, not passing through the skin. This is called console wire. Console means shantana.
means one wire going in the
One cortex to another cortex,
and not coming out.
not coming out the skin and the muscle. That is extra stability you are getting. Extra stability. Also, when you are drilling, if you are sincere, if you want to do good justice to your patient, try to learn Elizabeth. You shall get aeroplane all over the world. More than 30 to 40,000 planes. Sometimes
We are doing
you hear crash.
manual tensioning.
Manual tension. He's doing Russian tension.
Can you demonstrate tell
Yes,
the
yes,
viewers
yeah.
also?
It's very important কিন্তু আমি দেখি আমার জুনিয়র কলিগরা ওয়্যারটাকে ঠিকমতো ব্যান্ড করে না they don't bend the wires nicely as a result you are destroying your cloths looks ugly see wire bending is very important yes
Скажи, какой конец, такой
dynamometer the Russian technique if you don't have dynamometer now this is the dynamometer show them because they are learning
Without.
Yes. So this is sometimes you can use this is hexagonal hexa. Okay. You put, see this is dynamometer. This is original. Okay. 90 to 120 you can decimal Allah. Our proximal radius is migrated.
Second thing we have to put in radius.
Where we go for secondary?
Radius.
See?
This is because he is not engaging the elbow joint.
Elbow joint.
If elbow joint is engaging, then he has to put it in radius.
Radius. Okay. এখন দেখো, look from which side Dr. Dennis is putting the wires. See, so quick and a smart surgeon. See, both. And at the same time, yesterday I told you must pour this to prevent thermal necrosis. You must pour this one. See, আমরা কি ঢালছি দেখছো? Spirit, saline, water. You সব সময় you must respect the patient's hand, patient's leg. তোমার দেখো from the dorsal side.
Another one.
Dorsal side. This is the safe corridor. Nothing to be worried here. Okay? No kids. Our ring size for the children 60 mm. 60, 70, 80, but you will book, you see the 80 mm. If you think about the Western world, all the European countries, all the Russian, their size is more bigger than our this continent. Rota Lombaniasi, I will a little bit longer because we'll go for distraction. Edge, ledge হলো দুই রিংয়ের দুইটা হাফ রিংয়ের কানেকশন that is called ledge. These ledge, এই ledgeর সাথে you can put the wire, see, with the connecting. ও কিন্তু you must touch the radial artery here. That's Dr. Novikov, you see, he has put his hand in the radial artery and the tendons. You must avoid the vessel, radial artery. Kotha bolish na to? You must avoid the tendon and the radial artery. Put your hand finger here, and then you go. দেখতে পাচ্ছ? দেখো ডাক্তার তো সবসময় হাতে স্প্রিট বিলে গজ অলওয়েজ এভাবে দিবা। এগুলো হলো বেসিক থিংস, বেসিক থিংস। All the time, Russians 100% speed they all the time pour.
Another wire in the middle ring.
For stability.
Extra stability.
Yes, you can put. You can put. Yes, you can put.
Extra wire
Extra wire here, motion.
for more stability. Because we have this ball strings for traction and 3 wires, 2 screws and 1 console for the ulna head.
On mode.
And
You don't
this the distal base.
distal base. This is only one unit.
2 centimeters. It will be very easy, and after it, I think it will be very powerful.
তোমরা প্রশ্ন বুঝতে পারছো? প্রথম রিং, এরপরে I have given the second ring. Second ring এ extra একটা তার দিয়ে বাঁধা হয়েছে. We have given only one wire. See, and distally this ring 2 wires. Now these 2 rings is making a single unit. These 2 rings. Then when we discharge, we'll discharge between the radius and ulna. Then this bone, migrated bone, gradually will come down. The other things, देखो, तार के चेन ताला दाबेला. You cannot pull this wire. Whenever you feel like that, you can put the wire, a washer inside. We поставили is good. I am talking to the Russians. Is good means tourniquet. This is the beauty of Ilizarov. And yesterday you must have intelligence. L you can go for lingering. Then again I you can control infection. Z zigzag. That means deformity correction. A you are getting angiogenesis. R reliable. O opportunity. V create versatile.
Can you tell us the post-operative protocol, because that is the most important.
Anesthesia general দিয়েছে আমাদের প্রফেসর শহীদ সাহেব, তুমি দেখছো?
Try now.
Distraction.
Distraction. Because we planning for distract about 5 or 7 centimeters. So we remove this. We have a special lens of this. Remove this. And we have a fixation for it, and it's not trapped. And after it, we remove this. And turn this 4 times in a day of 90 degrees. And often solve the post-operative ache and for the patient.
Similarly, we do this side.
Same.
So, Dr. Bari, please tell the audience this.
Eta to near means
Three.
Stability.
We have a long road for perspective
Distraction. Yes. Now listen, what I am telling you, dear friends, this is very important. See the assembly of Ilizarov apparatus in case of this kind of deformity. Look. And now this is your proximal ring. Second and third ring is 1 unit. Mind it. Since there is only distraction, we have not cut any bone, nothing. You can start after 2, 3 or 4 or 5 days, whatever you like. You can go for distraction in between these 2. Tinta rod, this one and this one. Why? Because this is 1 unit, this is 1 unit, and this is another unit. 2 units here. These 2 rings make 1, this is 1. Because here we have put only 1 wire. So we'll go for distraction. Only the 3 rods that are connected with the first, second, and the third ring. We'll go for distraction 0.25, 4 times a day, 8, 12, 4 and 8 p.m. 5 centimeter, 50 দিন তোমাকে লাগবে 50 days. 50 days কোনো ব্যাপার না। So, first one is the Allah. 3. Now your assembly is so beautiful, see. Now proper dressing is very important. You cannot put like this, dressing low.
One duration of the 3 or 5 days after will make a distraction. However, these parts, both of these bones will be tracked by his rows. 1, 2, and 3. I mean, now listen. And these rows take a fixations of this base. And that's why these bones rings are not.
শুনতে পাচ্ছি বলো।
স্যার আমি ডক্টর নিত্য, আমি অ্যাসিস্ট্যান্ট রেজিস্ট্রার হিসেবে আছি মিটরে।
হ্যাঁ কি নাম?
স্যার ডক্টর নিত্য রঞ্জন বাবু, আমি স্যার অ্যাসিস্ট্যান্ট রেজিস্ট্রার হিসেবে আছি মিটরে। স্যার আপনার নেক্সট প্ল্যান হচ্ছে আলনার লেনদেন। আজকে কি স্যার কোনো প্ল্যান করে রেখেছেন আলনার লেনদেনের জন্য?
অবশ্যই আজকে তো করবো না, নেক্সট টাইম উইল গো ফর আল্লাহ লেনদেন। আল্লাহ এন্ড রেডিয়াস before correction. Finish. Mister?
Distraction is
Okay, finish.
Right, exactly.
তোমরা আবার এবার বাংলায় বলি so that they can understand I'm talking in Bengali.
Sir, I have a question, sir.
আরে শুনো কোশ্চেন আমি তোমার দেওয়ার আগে দিয়ে তুমি জাস্ট লিসেন। এখানে 3 রিগের কনস্ট্রাক্ট দেখেছো তো, প্রক্সিমাল, মিডল এন্ড ডিস্টাল। ওকে, ফিনিশ। Proximally we put the 3 wires, 2 crossers, 1 console wire. Middle wire only 1 wire in the radius. Proximally in the Allah. আমাদের মেইন টার্গেট হলো we will pull the radius downwards. Radius এর মাথা ম্যাগনেটেড হয়ে আছে। How? আমি বলতে শেষ করে দেব।
One base.
এটা দুইটা মিলিয়ে একটা ইউনিট। তোমরা কি কথা বুঝতে পারছো না? This is single unit. This is in the radius. আর proximal one in the Allah. Allah radius এর খেলা হবে। It is a very simple জিনিস। খালি একটু ব্রেইনটা খেলাবা, হিসাব নিকাশ করতে হবে। বুঝছো? এখন তুমি আমি ডিসক্রিপশন দিব মাস্টারের তিনটা রিং। তিনটা রড। 1, 2, 3. এই যে 3 এর নিচে যেটা দেখা যাচ্ছে। এখন এখানে ডিস্ট্রাকশন দিব, এখানে ডিস্ট্রাকশন দিব, এখানে এই যে ডিস্ট্রাকশন হাউ it will run come down 90 means 0.25 this না এখন তো আগে রেডিয়াস না মাপবো, আমাদের টার্গেটটা পুরো বুঝতে হবে।
So what is the distraction difference between the other cases same or not, sir? Sorry, the distraction duration and the movement is the same in the hereditary and the other cases.
Almost it depends. Sometimes you do little bit,
Distraction will change if you are doing lengthening. Lengthening you might have to do slightly fast. But for this, I think there is no lengthening will come. Software will
don't do your distraction. You can start, I told you, tomorrow.
My question, sir,
Okay, finish.
why we fix
Basic thing. Basic টা শিখো। If you learn basic, no basic, no advance. Please learn the basic. These are the basic things.
একটা জিনিস বলেন স্যার, আমরা এই যে ঘোরাবো, আমরা তো জানি যে 1 মিলিমিটার পার 0.25 করে ঘোরাই। এখানে আপনি বললেন কত 2 পয়েন্ট কত ঘোরাতে বললেন?
না আমি তো কাজে বলি না। 0.25 means 0.25 multiplication by 4 means 1 millimeter. 90 থেকে 90 করলে 0.25 যায়। 90 থেকে 90
জি স্যার।
খারাপ দেখো আবার দেখো।
জি স্যার।
This is 90 degree. When I will go for this, that means 90 to 90, I have got 0.25.
0.25 জি স্যার।
Dr. Bar, I show it.
কয়দিন থেকে
Enough equations. Okay, I show for example. Okay, I remove it. It's imagine that is 5 days after the operation. I came to this department and came. Okay, we will distract it. Okay, I remove you. I remove remove it. It's okay. I asked for a patient. It's painful for you. She said no. And now I make a distraction. Okay?
Bigger.
I just show you right now.
Yes. As far as the
The
percentage
first, the second, and the third.
Third.
Okay. And look at here. I tracked it. See?
See how much already come?
Не надо, не надо.
Oh, hey, better. See.
This is the traction, and you see that the head of the radius.
Yes.
So that's why it's not a magic.
Ah.
This is magic.
This is magic. Ilizarov is magic.
This is the beauty of Ilizarov.
It's the beauty of
তোমরা
Ilizarov.
দেখছো এটা হলো রাশিয়ান টেকনিক দেখো কি অবস্থা
Fix strong and
Russia has not only
all
games,
square. No.
থ্যাংক ইউ ভেরি মাচ আর কোশ্চেন আছে এই যে দেখো এখন রেডিয়াস আনলাই অপারেশন করবা ফ্র্যাকচার পাবা সাথে সাথে এইভাবে চলে যাবা চিন্তা করবো
And in the end of operation, we must check the tissues, the cutin. Okay, there is
no tension about the tissue skin. You must see the after the operation. You must see your apparatus. The apparatus. Whenever you go outside to see the prime minister or president, you wear a very good dress. And after you in front of the glass, you go see your shoes is okay, tie is okay or not. Ilizarov surgery, you must see that one also. After finishing the operation.
Hello?
Yes.
Hi friends, so this is Dr. Shamsul. I'm standing in the beautiful staircase gallery of Bari Ilizarov Center. So today we seen a very good case of radius anastomosis. So we have done a soft tissue, we are doing soft tissue lengthening, and Dr. Bari has been demonstrating the case of radius versus ulnar lengthening in the hereditary cases that we already discussed. And we had the surgeons here, Professor Bari and Professor Novikov and Dr. Manish, Dhawan, and we are all the faculty from India, Russia, and Iraq. Thank you.